Dr. Farnia here from Sonrisa's Orthodontics and Periodontics. So today I would love to share a case with you guys about how an orthodontic treatment can make a big difference in a patient's lives. Orthodontic treatment is something we do regardless if it's braces or aligners. Sometimes it takes like a year, sometimes 2 or 3 years, but at the end of the day, what we try to achieve with the orthodontic treatment is to give a patient a beautiful smile that is natural to their own teeth, that we're not trying to cut the teeth, to put crowns or veneers. And of course, those are some things that we can definitely do aesthetically after we get the teeth aligned, but the first step is always to get the teeth aligned. As you can see, we had a patient here. She was a younger patient, around 12 years old when she showed up to our office, had a lot of crowding, blocked out lateral. We have a premolar here that is blocked out. And as you can see, when she smiles, this tooth is way back and her smile is not harmonious, is not following her lip. In this picture, you can also see how the tooth is sticking out. This is what we call an overjet, where how far a tooth is compared to the bottom teeth. And of course, in this picture, we can also see how the profile of the teeth is compared to her lip. It's very protruded, the other tooth is in. And here the bite, we have something we call a little bit of a class 2, the canine, which is this tooth supposed to be right here between the teeth, and it's forward. On the other side, it wants to come in, there's not enough space, that's why it kind of stay up there. And also you can see in this arch form in the upper teeth, one tooth is in, the other one is out, there's not a lot of space. She still have one more baby tooth right here that was almost coming out. And the bottom teeth was a little crowded. The bottom teeth wasn't too bad. But then we were able to put some braces on. This is during treatment. She already been in treatment for a year. We were able to get the teeth lined up, bring the front teeth back. Then we start working on the bite because we want to make sure that our bite at the end is perfect and ideal. We work on the arch form, we got it right, and this is the results we got. The results, we love it so much that all the teeth are biting better, like the alignment is really good, the occlusion is really nice. What I love here is you can see how it follows her lip. Of course, something later we're gonna recommend to her is gingivectomy, where it's like you cut the gum right here to match to this side, so that way even it's gonna make a bigger impact on her smile. But this is a picture I love. This is what I love to see when I see my patients, how her front teeth are not protruded, their overjet is reduced, it's very nice to her lip profile, and the occlusion. This is what we want to see. We want to make sure the bite is perfect, the teeth are coming together, the bite is really nice, and the same on this side. So these are the things that we kind of look at our patients, every single patient. We want to make sure our arch forms are nice. We want to make sure all the teeth are in the right place. And those are the things that we like to do to make sure that our treatment is done right. So as an orthodontist, I've been to school as a be a dentist and then extra years of a school and training to be able to treat cases. Those are the details that we look at every single day. And this is not just one patient. We do that for every single patient. Our goal is to have a perfect smile at the end of the day. And if we can avoid to have other sort of treatment, whether it's extraction, veneers, or other things, if it's not needed, that's what orthodontic treatment does. That's what and it lasts forever if you wear the retainers. That is why it's so important to wear your retainers, because that's what is going to maintain the smile for the rest of the life. So this was just one of the simple cases that we have done in Sonrisa's. We have done much more complex cases that I'm going to share with you regarding like how we treat cases like that, because we are a clinic that is a multi-specialty clinic. I'm an orthodontist. We have an orthodontist periodontist, Dr. Cruz, in our office. We have other orthodontists in our office as well. We work together as a team to make sure that the results that we deliver to our patients is the best smile. And we cannot wait to see you at Sonrisa's.